Okay, everybody. Last medical article from this issue of JAVMA, January 15, 2015. We're going to be talking turtles. And here's the study. The evaluation of plasma fibrinogen concentration as a diagnostic indicator of inflammation in red-eared sliders, Trachemys, scripta, elegans. And this study comes out of University of Illinois and Colorado State University. I imagine those who are interested in this are a small niche, but hopefully you find it interesting. I certainly did. Objective: to critically evaluate plasma fibrinogen concentration as a diagnostic indicator of inflammation in red-eared sliders. Trachemys, scripta, elegans. It's a prospective study, 12 purpose-bred red-eared sliders and 153 farm-raised red-eared sliders. Procedures: they measured fibrinogen concentration in platelet-poor plasma from red-eared sliders. Some of the turtles were inoculated with the rhinovirus or sterile PBS solution. I didn't find what PBS stands for here, but regardless. And they had some turtles that were healthy and some that were overtly ill. The ones in this picture here are overtly ill turtles. The fibrinogen concentrations in the rhinovirus infected and physically ill turtles were compared with those of healthy turtles. Results: fibrinogen concentration did not differ significantly between healthy red-eared sliders and rhinovirus infected or overtly ill red-eared sliders. Conclusion: a reference interval for red-eared slider plasma fibrinogen concentration was established and partitioned by sex to account for considerable right skewing observed for females. Fibrinogen concentration was not a useful indicator of inflammation in red-eared sliders with rhinovirus infection or other overt illnesses. There you go. Introduction. The acute phase response includes fever, behavior changes, plasma protein changes, and is a programmed biological reaction that mediates tissue damage and promotes a return to homeostasis following inflammation, cancer, and stress. In reptiles, the diagnosis of inflammation is challenging. Several diagnostic methods fail. For example, white blood cell counts are not accurate indicators of an acute phase response in chelonians, which are, I think, the broad group of what describes turtles. Mild alterations in plasma protein concentrations have been detected in ill loggerhead sea turtles, caretta, and red-eared sliders by plasma protein electrophoresis, but additional studies are needed. Inflammation induced by Aeromonas hydrophila infection in Chinese soft-tailed turtles, which are Pelodiscus sinensis, was associated with changes in liver expression of several acute phase protein transcripts consistent with a mammalian acute phase response, including increases in fibrinogen RNA transcripts. Several methods have been used to measure fibrinogen concentration. The gravimetric method, which defines plasma fibrinogen concentration as the mass of the fibrin clot isolated from a plasma sample, and is considered the gold standard for fibrinogen measurement, but requires a large volume of plasma. There's the Claus method, CLAUSS, which compares thrombin-induced clot time to a standard curve to determine fibrinogen concentration. However, an increased concentration of plasma heparin-like molecules seen in red-eared sliders during torpor affects the results of the Claus method. There's the heat precipitation method, which measures changes in total plasma solids concentration after precipitation of fibrinogen at 58 degrees Celsius. Fibrinogen and other heat precipitating components, including fibrinogen degradation products, are measured by using this protocol. And finally, the Jacobson method begins similarly to the gravimetric method, but the clot is dissolved and the optic density at 280 nanometers of the solution is used to calculate fibrinogen concentration. In mammals, the best correlation with the gravimetric method is attained with the Claus or Jacobson methods. In green iguanas, iguana, the Claus and heat precipitation methods correlated poorly with the gravimetric method and were deemed inappropriate for use in that species. The frog virus 3 like virus is a ranavirus that causes clinical signs of oral discharge, stomatitis, respiratory distress, heterophilic splenitis, vasculitis, pneumonia, and fibrinoid necrosis. Ranavirus infection in amphibians is designated as a reportable disease by the World Organization of Animal Health and has been associated with high morbidity and mortality in wild reptiles and amphibians. Red-eared sliders infected with the frog virus 3-like virus have clinically and histologically confirmed inflammation. White blood cell counts are not affected. Interestingly, at the time of PCR assay-based confirmation of viremia, changes in plasma protein concentrations consistent with acute phase response were observed in the ranavirus-infected red-eared sliders, including decreases in total plasma protein and albumin concentrations, and an increase in beta globulin percentage. My goodness. All right. Let's see here. We're going right to the results. The Jacobson method was successfully modified to measure plasma fibrinogen concentration in red-eared sliders. In linear regression analysis, equine samples were noted to lose linearity at concentrations at over 1.5 mg per ml, whereas samples from red-eared sliders were linear at all concentrations tested. The calculated extinction coefficient, which is mils by mg to the negative 1 by centimeters to the negative 1, so mils per mg per centimeter, 1.08 for equine fibrinogen and 0.92 for red-eared slider fibrinogen. All test combinations passed the cumulative sum control chart test for linearity, indicating a linear relationship between modified Jacobson and gravimetric methods for measurement of fibrinogen in red-eared slider platelet-poor plasma. Importantly, reliability coefficients were considered excellent, meaning over 0.75, and indicated that a single measurement should produce an accurate result with acceptable confidence. The protein sequence resulting from the liquid chromatography mass spectrometry analysis matched the painted turtle, which is Trachemys picta belli, predicted fibrinogen sequences with 46% recovery of the alpha chain, 61% recovery of the beta chain, 51% recovery of the gamma chain. No differences were noted in the protein electrophoresis band patterns of male and female red-eared sliders. And then this is a chart I'm going to reference right now for those who care to pause it and look at it more specifically. It says there that the black arrow on the chart indicates the statistically determined cutoff concentration for healthy males at 3.8 mg per ml. The gray arrow is the statistically determined cutoff concentration for all healthy farm-raised red-eared sliders, not stratified by sex, and for females were 6.9 mg per ml. The mean fibrinogen concentration did not differ significantly in ill versus healthy turtles. Discussion. The modified Jacobson method was successfully adapted and functionally validated for the purposes of the present study. The assay is technically easy to perform and inexpensive. The extinction coefficient for fibrinogen of red-eared sliders differed from that reported of green iguanas, 1.19. All right. To our knowledge, this is the first report of the protein sequence from a freshwater chelonian. The protein sequence for red-eared sliders matched well with the predicted sequence from a phylogenetically similar turtle. Electrophoresis results indicated that the red-eared slider fibrinogen had a migration pattern similar to that of equine and confirmed that the major plasma protein removed from red-eared slider plasma by the modified Jacobson method was fibrinogen. Therefore, we consider the modified Jacobson method functionally validated for the purposes of the study. Investigation into the effects of sample handling revealed that the fibrinogen concentrations in properly stored heparinized platelet-poor plasma from red-eared sliders are stable at 80 degrees Celsius for 6 months or less, and when exposed to 3 freeze-thaw cycles. Mild hemolysis at 0.5 mg per dl did not cause significant changes in fibrinogen concentration, but was visually detectable as a slight red discoloration of the clot during assay processing. Therefore, close visual examination of samples is recommended. The fibrinogen concentrations for males were normally distributed, but the distribution for females had a visibly distinct right skew. This observation led to the decision to partition the data by sex. When evaluating the broad fibrinogen concentration reference interval in female red-eared sliders, it is important to remember that these were egg-laying animals and samples were collected during the reproductive season. Reproductively active oviparous female reptiles have changes in circulating concentration of calcium, phosphorus, cholesterol, vitellogenin, lipoprotein, and total plasma protein. Additionally, constituent concentrations of common plasma proteins like albumin have been shown to be influenced by estrogen. High fibrinogen concentrations are associated with pregnancy and parturition in humans and a variety of other mammals. It seems likely that the skewed nature of fibrinogen concentration in female red-eared sliders of the present study is reflective of alterations in calcium homeostasis during oviposition, the role that vitellogenesis-related proteins play in clot formation and assay for performance, or a combination of these factors. That's interesting. I wonder if they knew that before they did the study, or whether they realized that when they're trying to figure out why are the female numbers so off from the male numbers. Inflammation had been confirmed in necropsy in rhinovirus infected purpose-bred red-eared sliders. In contrast to mammals, in conclusion, in which biological processes are more consistent across environmental conditions, ectotherms, including chelonians, have an altered metabolic and immune function with a marked difference in innate and adaptive immune response at suboptimal temperatures. The purpose-bred red-eared sliders have been intentionally housed below the preferred internal temperature range of 24 to 30 degrees Celsius for healthy adult red sliders as part of a larger study of rhinovirus pathogenesis. Temperature may have affected the fibrinogen acute phase protein response in these turtles. However, similar findings were present in the farm-raised red-eared sliders, which did not undergo intentional environmental intervention. Our data suggests that fibrinogen concentration is not a good indicator of inflammation of this species. And that's it for this journal. So for veterinarians who work on turtles, there you go. For what it's worth, you may have already known this. And then for those who own turtles, essentially, if you speak to a veterinarian who's trying their best, who doesn't know turtles but is trying their best because they're the only veterinarian in your town, realize, or at least make them aware, that the inflammatory patterns we usually expect to see in mammals is just different in turtles. All right, everybody, we're going to start a new journal tomorrow. Thanks for watching and thanks for subscribing. Bye-bye.